largest contributor to the World Health Organization, China far below that. Joining us now is Elisha Dunn-Georgiou, President and CEO of the Global Health Council, a nonpartisan group that advocates for global health. Thank you so much for being here. I've seen reporting that the leaders of the WHO say that there's still time possibly to negotiate with the Trump administration over this announcement. Regardless, if the United States is out of the World Health Organization, what will the impact be for World Health operations, do you think?
Well, thanks so much for having me, Kate. I'm glad to be here and talk about this really important issue. So just to say that the executive order that was issued is an intent to withdraw. There's a stipulation that the withdrawal is a year-long process, and that's why you're hearing from the World Health Organization some hope that there are opportunities to still negotiate with the U.S. and prevent the U.S. from withdrawing. I think it's important to note that membership in the U.S. is actually quite beneficial for the United States on a number of fronts. One is that we have, through our membership in WHO, access to real-time global health and surveillance data about emerging threats that may initiate abroad, but definitely put the lives of Americans at risk. And this helps our own Health and Human Services Department to prepare for any diseases or incoming threats of public health that we may see on the horizon. It not only helps the Department of Health and Human Services, but it also helps state and local health departments be prepared as well for emerging infectious diseases. Without membership, the U.S. does become more vulnerable to these health risks because we won't have access to that data and surveillance. It's also really beneficial for the U.S. to stay at the table. I hear President Trump's frustration with the dues and the membership fees, but I think it's really crucial that we recognize how much influence the U.S. does yield at the World Health Organization as one of its founding members, both with the organization itself and inspiring reforms that further efficiency and reduce costs, but also influence with the other 193 nations, including China and Russia, India, a lot of countries that may, in the absence of the U.S., take the opportunity to step into that vacuum and shape the global health world in a way that they want to see that actually wouldn't further U.S. interests or protect American people.
So that is quite interesting, because you can be sure of few things in this world, but you can be sure that one of the intentions of President Trump in making this move would not be to allow China to give China more influence over anything, or China a bigger seat at the table, considering the way he's talked about it for so long. But you think that when the leading contributor, being the United States, would withdraw from, well, any multilateral organization, someone's going to step into its place. You see this as, I don't know, an opportunity, actually, and maybe even a historic one for China if the United States does withdraw?
I think that is a real risk. I think that the U.S. has played an extremely constructive role in helping to shape the way these multilateral partnerships work, particularly at the WHO, and to keep policies and other, attacks on what we would see as American interests at bay in these multilateral institutions. And so you can't do that if you're not there. So I think it is really important to consider what stepping away would mean, particularly in terms of access to data, surveillance information, other emerging health threats that may, be transferred from animals to humans, that we're just not going to have the same access to if we're not members of WHO. So if we're at the table, we can push for greater transparency, greater accountability. But if we walk away, then that leadership gap is there for the taking.
That is a really interesting element to this. We'll see kind of what impact it has and what this means. As you said, it's an intention to withdraw. It appears that it's a year-long process for the United States to do what Donald Trump says he very much intends to do. So we'll see together. Elisha, thank you very much for coming in. Sarah?